Doctors of Reddit, what was the most shocking case of, oh, I thought that was normal you've seen in a patient? Nurse here. 67-year-old thought she was pregnant. Gotta say, she looked pregnant in that it was all in her abdomen, like some pregnant women who look like they're carrying a basketball when they are at the end. But she was 67. Turns out it was a 37-pound ovarian cyst. I asked if I could watch the surgery. That thing came out all in one piece. I'll never forget the sound it made. This was at a community hospital many years ago before HIPAA, so naturally the lab announced that anyone who wanted could come down to the lab and view this incredible thing before it was dissected by pathology. The line at lunchtime was so long you'd think they were giving away free concert tickets. Holy shit. 37 pounds that's a big imaginary baby. When I was a medical student, a patient and his brother came in together. Patient was just a post-op visit after a hernia repair. Found out he had another baseball-sized hernia. His brother, on the other hand, had literally had a football-sized hernia visibly coming out of his left leg of his shorts. Looked like an inguinal hernia, and he was able to use it as an armrest. I asked him if that bothered him at all, and he straight up said, "My brother's hernias were painful, but this isn't, so I thought it was just a quirky defect." I hope he was lying to save face, but we recommended he get it taken care of. OBGYN here. I've pulled so many things out of vaginas that people claim they didn't know were in there or don't think it was abnormal to leave them in there. Old rotting medical devices, what looked like a plastic car wheel or bottle cap, used condom, old tampon, insects, you get the drift. MD here. A couple years back, had a walk-in complaining of a few months of abdo pain swelling. I shit you not. The man was Simpson's character, yellow with jaundice and ascites, fluid filling the belly. He seemed shocked when I told him I was calling the hospital to arrange direct admission. When I was a med student, we visited a clinic in the country where I studied. Lots of people will get horrible injuries and use the local elixir of dirt, jotted motor oil, spit from the local old lady to patch up an exposed arm bone or whatever. Had one woman in her 20s come in with a fungating breast cancer that looked like a hard mushroom shiach mold growing through the skin and to the outside world, constantly bled anytime you touched it. Her family shamed any injuries or impurities, and she thought she just needed to keep it covered until it got better. I'm making my internship, and one night I was attending at triage at ER. Triage is the area where you check the patients and decide how urgent is the attention they need. Context here, I'm in a third world country and I'm at a public hospital that attends uncovered population. And instead of one hospital with all the specialities, we have three. The main one, the Jayo Hospital, and the Children's Hospital. So I had this woman of late 30s. She started telling me that she had an extreme pain. 10 out of 10 in the lower abdomen, no other sign that food could be involved. Neither kidney stones or urine infection. I proceed to ask about last menstrual cycle. She doesn't recall the exact date, but she says that was like 4 months ago. Without hesitation and without asking more or anything else, I told them, she and her familiar, to go right away to the hospital that was crossing the street. Because if it was something obstetric, we didn't have any guayo in this hospital, and if it was something of general surgery, they had general surgeons there. We got a call like 20 minutes later. LOL, that woman delivered her baby at triage of the other hospital. Was the baby born prematurely, or did she have her dates wrong? She got a full-term baby. As others pointed, you can have spotting even while you're pregnant. ERMD here. Had a patient come in for cast removal literally years after it had been put on. She had just decided it wasn't worth taking off. Her leg skin was literally growing over the top of the cast and then down it. Once we finally cut the cast off, she was surprised to find that she had no skin underneath, but the dead tissue over her muscles and bones was being cleaned by about 300 maggots. I knew by the smell that something under there wasn't right, but wasn't expecting that. Patient seemed completely fine with it. Whatever. Edit. I've got tons more of these stories. That was just the first one that came to mind. Resident doctor here, although not an obgyn. In my obgyn rotation in medical school, I had a patient who was a first-time mother having difficulty nursing her baby. The patient said she had some redness and it had been hurting to nurse on one nipple, so she often had to switch until finally it became unbearable for her to nurse from either. She had mentioned that she thought her nipples might be cracked or chafed. When it finally came to the exam, she had the most chafed nipples I had ever seen. It looked totally raw and macerated to the point that they looked like two large pepperoni slices. One of her breasts also looked like the wound had led to mastitis. It definitely led to a new appreciation of how difficult breastfeeding can be on new mothers. OMFG, my vag just sew herself closed. Psychiatrist here. One of my first patients was a female college student that couldn't sleep because of the voices that constantly talked to her and she felt forced to answer them at all times. From what she was saying, I gathered that depending on the particular voice with name and identity, she was either cautioned about some people or situations or outright pushed towards violent acts. Her voices appeared when she was 16, if I remember correctly, and we've met when she was 20. So, at that point, for 4 years of her life, she believed that it was normal to have such voices in your head. Because, as she explained, many people talk to themselves. To some extent, she was right, but I had to explain to her that they really talk with themselves. That there are no other identities in them, but only an internal dialogue to clarify or resolve issues that bother them, in their own privacy, so to speak. She was later diagnosed with schizophrenia. Patient with cancer, SCC of their finger. It ate the entire fingernail, the nail bed, tip of the finger. Probably a year of growth. Eventually got them to let me see under their band-aid at the cut that wouldn't heal. They had no fingernail. Had to scrape the bone BC, the cancer grew so deep. Healthcare worker here. I ran into a patient who had one or possibly both heads of her biceps completely ruptured proximally and curled back on itself, so she looked like Popeye. I sheepishly asked her about it, and she just shrugged and said it didn't hurt, so she didn't worry about it. You do have 3 muscles that flex the elbow, but still, the biceps is pretty important. Patient here. Went to the doctor for a note to have a day off work since I didn't feel great and just didn't want to work. Doctor poked me in the stomach, said that's not normal, and sent me off to have a scan, which took me 2 months to get around to. 2 weeks later, I get a letter from the doctors asking me to come in. Change my shifts, so I go, and the doctor went off at me for not coming in sooner, and told me to go home and pack a bag. I'm off to the Royal Brisbane. It might be cancer. More scans later, and it's decided that it's not cancer. It was a 4-kilogram cyst. My only symptom was an enlarged stomach and the "you're getting fat" comments from my mother. Not a doctor, but have a story. My oldest son was 11 years old and needed a physical for youth tackle football. We had a new doctor, so she went into more detail than most physicals. He had complained that his ankle hurt during the middle of baseball season, so she asked if he could take off his shoe. When he did, she immediately points to the side of his foot where there was a strange bump and informed us he had a broken foot. I didn't believe her, as I pointed out he had the same thing on his other foot as well. She took a look and said, "Oh, he has 2 broken feet," and sent us over to get x-rays from the hospital. I was laughing, thinking this was so crazy, believing there was no way my son, who not only finished playing in a baseball tournament, but who was running and jumping at the swimming pool literally an hour before, had 2 broken feet. After the x-rays were completed, my smile quickly faded as the doctor was right. That is when we learned about completely flat feet and the damage stress fractures can do when they go undetected. 8 weeks of cast and special shoes and insoles for the rest of his life solved the problem. His feet are still deformed, but it never slowed him down. Work at a dentist's office. Patient presents for an exam. Concerned part of her tooth has chipped off. On examination, it is not in fact a tooth that chipped off, but rather a piece of calculus, which is buildup of hard tartar that covers your teeth over time when you don't brush them. It can be small deposits, or in this case, an entire bridge covering her actual teeth. She thought the calculus was tooth material and was quite shocked to learn we were actually unable to see her real teeth and she'd need an extensive cleaning to remove it all. Paramedic here. Once saw a lady in her late 50s with a goiter a little larger than a fist. She had been otherwise healthy her entire adult life and had not once seen a doctor about it because her brother and father had the same thing, so she assumed it was just a genetic thing that she had inherited. I worked with the Amish for a while, so I've got some great I finally got around to addressing this after taking care of my harvest stories, but my favorite is actually a non-Amish chick. She was asking why she gets rib pain so often and literally reached under her own rib and jiggled it with her fingers. Turns out there were a lot of other things she could do that she shouldn't ever be able to, and she had a variant of Ehlers-Danlos. Literally, I was so distracted by the popping in and out of her rib, I didn't even notice how horrifying it was that she could get her hand under there to begin with, until I retold the story to a coworker. My mom is a medical assistant in a pediatrics office. Like 2 years ago, a lady came in with a gash in her heel. She'd had the gash open for weeks. My mom undid the wrapping the lady put on her foot, and there were maggots eating at the lady's flesh inside her foot. The lady thought that the tingling was a bad sign and that she should get a checkup. She said that she thought the tingling was normal and just wanted to check. My mom and another MA had to dig out 6 maggots from this lady's foot. The night she told me this, I was dumbfounded by how stupid this woman was not to go to a doctor once she got the gash. There are so many, but perhaps one of the most stunning was the man who thought searing pain while urinating every once in a while was normal. He would have tremendous back pain for a day or so, which he thought was due to advancing age and the highly physical nature of his job. Not incredibly unreasonable, but something he should still have checked out. Usually a few days later, he would have searing pain while urinating, then be fine again. Of course, it turned out to be chronic kidney stone formation. He said he never noticed the stones coming out because he never looked down while urinating. Honestly, I still don't understand. I have had kidney stones myself, and it definitely feels like something solid coming out. PA at my pediatrician thought a spider bite in my arm was swollen, an appropriate amount, and told me not to touch it. Went home overnight, and it was twice the size the next day. Went back and asked to see my normal doctor, and she immediately sent me to the ER. They drained a quarter cup of pus out of a bullet-sized hole in my arm, and I had to be treated for MRSA, and now I have a cool scar from a brown recluse spider bite. Somehow, didn't lose my arm, but almost did BC. The PA thought I was overreacting, and my arm swelling to twice its size was normal. Not a doctor. My buddy was doing a cable service call for a new customer. They were just chatting when the customer explained he had brain surgery recently and pulled off his hat to show the scars. Buddy said he gagged and called 911 immediately. His head was full of maggots and looked like meat left out too long. The customer was elderly and no relatives lived close by to help care for him. He thought the aches were from surgery and ignored it.